Welcome to Manguin's Malaria Special. Today, we're talking about malaria. While virtually non-existent in North America and Europe, malaria affects many other regions, specifically South America and Africa. In 2018, an estimated 22 million cases of malaria occurred worldwide, and 405,000 people died. This is an enormous step from where we were in 2000, which was nearly double both of these statistics. Malaria is a parasite that lies in blood, which makes its transportation through mosquitoes so dangerous, rapid, and common. Being bitten by the infected Anopheles mosquito, again, is the most common way of contracting the disease. A majority of deaths from malaria come from African children who have not developed a strong enough immune system to fight the virus. They normally contract this virus from their parents who are already affected by the malaria parasite, normally contracting that virus congenitally from their mothers. As a statistic, malaria kills one child under 5 every 30 seconds. When the mosquito bites you, the parasite is released into your bloodstream. There are 4 common strains of the Plasmodium parasite: Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium falciparum. Plasmodium falciparum being the most dangerous and will most likely cause death if not treated immediately. Once the parasites are inside your body, they travel to the liver, where they mature. After several days, or up to a year in special cases, the mature parasites enter the bloodstream and begin to infect red blood cells. Within 48 to 72 hours, the parasites inside the red blood cells multiply, causing the infected cells to burst open and collapse. The parasites continue to infect red blood cells, resulting in symptoms that occur in cycles that last 2 to 3 days at a time. An attack usually starts with shivering and chills, followed by a high fever, followed by sweating, and a return to normal temperature. The malaria cycle as it pertains to mosquitoes and humans interactions is often understated. An uninfected mosquito will feed off a person infected with malaria, and the malaria parasite will then transfer to the mosquito. The mosquito will then transfer to many other humans as they feed off of the uninfected humans. This cycle will continue as it goes on to spread. That is why it's so astounding to see our society has curbed this rapid spreading parasite. The symptoms of malaria. People with malaria often experience fever, chills, headaches, nausea, vomiting, muscle pain, fatigue, sweating, chest pain, and a cough. While malaria is an enormous disease that is hard to fight, it is often hard to miss the economic impact that is also left with malaria. Since most of the places that malaria affects are third world countries, they often have to spend a lot of their money and well-being on the well-being of their citizens, which is often difficult for third world countries who are trying to step up and expand and become more profitable. Now we're going to talk to Julio on how to prevent malaria and ways that you could possibly cure malaria if infected.
Hello, I'm Julio Cruz, and this is how to prevent malaria. While normally it takes 2 weeks for someone to show symptoms, some types of malaria parasites can lie dormant in your liver for up to a year. Isn't that something? A lot of malaria prevention relies on talking to your doctor. So talk to your doctor if you experience a fever while living in or after traveling to a high-risk malaria region. Also, talk to your doctor about long-term prevention if you live in an area where malaria is common. Sleeping under a mosquito net may help prevent being bitten by an infected mosquito. Covering your skin as well, or using bug sprays containing DEET may also help prevent these infections. There's no vaccine available to prevent malaria, so talk to your doctors if you're traveling to an area where malaria is common, or if you live in such an area. You may be prescribed medications to prevent this disease. Some of the common drugs to treat malaria are Malarone, Chlorinique, doxycycline, and primokine. These medications are the same ones used to treat the disease and should be taken before, during, and after your trip. Thank you for listening to what we have to say and what I had to teach. This has been fun. Good night.